The Caribbean Public Health Agency, Carpha, in a release on Friday, advised that more stringent measures and robust surveillance be put in place at various ports of entry at all Caribbean nations to guard against the coronavirus. According to the World Health Organization, common signs of infection include respiratory symptoms, fever, cough, and shortness of breath, and breathing difficulties. In more severe cases, infection can cause pneumonia, severe acute respiratory syndrome, kidney failure, and even death. Standard recommendations to prevent infection spread include regular hand washing, covering mouth and nose when coughing. It was also advised to avoid close contact with anyone showing symptoms of respiratory illnesses such as coughing and sneezing. Executive Director of Carpha, Dr. Joy St. John, explained that the risk of the novel 2019 coronavirus remains low for the Caribbean region. She added that the low risk in the Caribbean is due to the fact that there are no direct flights from China to the Caribbean and travelers will receive multiple screenings before arrival to member states. There has been no report of the virus so far in the Caribbean region, according to Carpha. Carpha said, quote, "The International Health Regulations Emergencies Committee is not recommending trade or travel restrictions at this time. Carpha urges regional national authorities to work with airlines, passenger ships, and other transport and tourism industries to ensure that Caribbean residents and visitors alike remain free of the coronavirus." Meanwhile, Ghana has already begun to implement its own precautionary measures at all major and minor ports of entries. At a press conference earlier this week, Deputy Chief Medical Officer Dr. Karen Gordon-Boyle explained what will occur in the coming days.
But for now, our focus is mainly on the larger ports where the risk is a little higher. But we haven't forgot that there also are porous borders and we will have persons coming up.
In that case, has the ministry deployed additional health officers?
Yes, so we recognize one of our ongoing problems is the lack of human resources. And so for an interim period, we are deploying extra environmental health officers and extra medics to our ports. As we speak, we'll be making that kind of arrangement with terms of notifying persons that they have to be transferred. Might be just for a 3 or 4 month period until this acute threat blows over.
Chief Medical Officer Shamdeo Prasad explained that a number of health personnel have been deployed to several rural and interior locations to help with the required surveillance needed to guard against the coronavirus.
We have presence at Latem, at Molson Creek, Port Health presence, with support from the other agencies, Customs and Immigration. We also have at the 2 main seaports, Georgetown and New Amsterdam Seaport. Georgetown Seaport is actually covering the FBOs, they call them, the FBO sites. These are the sites out in the exclusive economic zone, and the Port Health officers actually do go out if they do have persons who are coming directly to those sites on vessels.
Dr. Prasad stated that just like its Surinamese counterparts, persons entering Ghana through major and minor ports of entry will have to provide immunization documentation to port officials.
We have been instituting, like our neighbor Suriname, stringent measures to ensure that persons are fully covered by vaccines, particularly yellow fever, because we can't just get carried away, as I keep emphasizing on this issue, and forget that there are other threats that do present itself to our borders, including yellow fever. So we are ensuring that at the points of entry that we continue to monitor immunization status and ensure that persons coming in are adequately covered for those vaccine-preventable diseases, including yellow fever and measles.
Javon Vickery, HGP Nightly News.